Our goal is here. It's towards a world without blood disorders of all sorts, whether they be malignant or non-malignant. And we have a mission, a crafted mission, to promote excellence in 3 areas: patient care, self-evident, and then research and education. And the reason for those 2 there is because research is really the engine that drives all of the improvements, and those improvements can only really be put in place by educating people, and it's a combination of those 2 that will drive our ability to improve the lives of patients. So, I'm going to talk you through the research and the education in very brief detail. So what do we do on the research area? Well, we actually support what we hope to be the leaders of the future. So we have a number of research grants spanning 2 years, substantial amount of money per year. And some of these are for clinician scientists, people who are trained both to be a doctor and also to do research, and also the non-clinicians. So they are targeting both audiences. And as I say, these are essentially to support the very best people who will be the leaders of the future. We also have a training scheme specifically now tailored to one of the 3 areas of research that we believe exist. There's basic research, there's translational or disease-focused research, and then there's clinical trials, actually getting things into patients. This is a new scheme we started last year, clinical research training in hematology. It's to train young hematologists to become specialized in the area of clinical trials. And this is the first of its kind in Europe, actually. And it's a 9-month-long course, and we have about 18 trainees on it, and we have a similar number of mentors. And it's very popular, and it got off to a great start last year. In parallel, we have this, the TRTH. This is translational research training in hematology, targeting those people who want to understand at a fairly fundamental level how diseases occur. And again, similar format, spread over the bulk of a year, a faculty of about 20 and about 20 trainees on each course. And again, we're really looking to train the leaders of the future through these. And this year, starting for the first time, we're having a whole 1-day meeting to be organized by the very younger researchers, trying to get the old people like me out of the room and give these guys a forum to organize their own research meeting. And this is going to be every year now, the day before the meeting starts properly on the Friday. So that was a quick overview of the research side. What about education? We have a lot of activities in this area. Some of them are shown on this slide. There's an online learning center. We have meetings and tutorials, not just throughout Europe, but in fact throughout the world. Europe is challenged in so many ways at the moment, but one of the ways for hematologists is that hematology isn't the same in every country. So a hematologist in one country may look after patients with leukemia and also patients with blood clotting problems. In another country, they may only look after patients, and it's a different training for somebody who looks after patients with blood clotting problems. So there are different flavors of hematology around Europe. One way to try and make life easy when a hematologist wants to go from one country to another is to put in place an overarching curriculum so that they can, if you like, tick off what they have been trained to do, and it becomes clear what they have not been trained to do. So when they go from one country to another, it's clear what they can do and what they need further training to do. And that's the whole basis of the European Hematology curriculum. It's associated with actually a passport that they can get ticked off. It's not to enforce how people are trained in different countries. It's just to make transparent what the differences are. And this has led actually to, for the first time this year, in fact just 2 days ago, a European Hematology exam. Again, based on this curriculum, people can take this exam and it becomes a credential that gives them a way of moving around Europe. So we think that's rather important. As I said, this was launched here, and we actually, somewhat to our surprise, we had 100 participants for the very first exam. So we thought that was really tremendous. And then we have another role, I think, and that's to stand up for hematology and hematology patients, particularly when it comes to questions like affordable drugs. How do we deal with the rampant increase in drug prices for all the new and exciting therapies that are coming on? How do we lobby Brussels to get changes in what's happening? And there are a number of other issues shown there where we are also lobbying Brussels. And I think the next slide is just to remind those from the UK in the room that some of us need more help in lobbying when it comes to Brussels than others just at this moment in time. Okay, so then reaching towards the end now, this is an example of something that has come, a very positive something that's come out of what EHA has been able to do. So we've been able to pull together a large number of countries to sign a joint declaration about what should be the minimum training time for hematology. Again, this is very varied in different countries. In some, it is what we think is far too little to train a hematologist to be credible and properly functional. So that's what this Madrid Declaration is all. It's calling on the national authorities to raise the minimum training period and to harmonize the requirements in lines with this curriculum that I've already mentioned. So that's going to be signed by not just EHA, but approximately 40 different national societies. So this goes well beyond Europe. And very lastly, I think just to tell you, we're launching a new journal. This is going to be called Hemasphere, a new online open access journal, very different to what is currently out there. And we're launching that again at this meeting. So it's a very exciting meeting for us. And I think that's all I wanted to say about EHA. If you have any questions, I'd be delighted to field them now before we move on to Shai Israeli and the scientific program today.